Somebody probably told you that nursing can be a gross job, and I'm here to support that statement. Yes, you can deal with some of the most grossest things ever when you are a nurse. So I'm gonna go down the line of some of these grossest things. Hopefully you don't get grossed out by what I'm saying, but this is real life, and I'm going to tell you some of the things that I encountered, some I didn't encounter, thank God, but some of these things you will have to deal with depending on your specialty. And this is all acute care from the perspective of a registered nurse, so let's get into it. So there are some things that you can probably guess that we already deal with, or you would deal with at the bedside, but I'm going to first address some other things that you might not know. So first off, the category of wounds. Severe wounds and ulcers can be very hard to deal with. There's smells, there's stuff that come out of it. There's pressure ulcers and bed sores, and they are really deep and embedded in there and affect multiple layers of the skin. They become infected and they expose tissue and sometimes bone, depending how deep it is and what stage it's in. Tendons as well. You will need to clean those wounds. So debriding is what we call it, or debriding. You will have to remove the dead tissue, and then you're going to have to dress it, and all of that smells that come with some wounds can be off-putting, to say the least. Aside from that, there's necrotic tissue or gangrene. So totally dead tissue or gangrene. Obviously, there's going to be a rotting, putrid smell to that you're going to have to handle. Then there's going to be some wounds that come with maggots. Yes, I said maggots. Or some other kind of or some other kind of insects. And in some extreme cases, you will find some wounds that have those embedded in there. You'll see them. It's gross. And sometimes it'll be a treatment. Yes, believe it or not, some doctors will actually utilize those types of things to get some of the dead tissue from around a wound. They will actually put some maggots in it. So you'll have to deal with that as well. But on some occasions, people that come from less sanitary environments may come in with some maggots in their wound. Then there are some skin folds that you'll have to deal with, and what comes with that. When we have a population that has a lot of obesity, you will encounter people that have folds that you will have to clean under to prevent further skin breakdown. And so that creates an environment for bacteria. There's moisture there, and it can have a lot of unpleasant odors and sights that you will encounter with that. Now, with that comes the lack of personal hygiene. We all come with some kind of body odor, right? But a lot of people don't know how to manage that or have good personal hygiene. So you will find people that still wipe from back to front, which you're not supposed to do. And there will be people that come in for urinary tract infections because they do that, or something worse. You will encounter people that have poor oral hygiene as well, and you'll have to help them brush their teeth or take care of themselves if they're not able to. So all of these things you will encounter as a nurse as well. There are also those unusual or extreme situations where a patient might have a foreign object in places. I had a patient who had to have a foreign object removed from their anus during sexual play. Things went a little bit too far, and they actually asked for that tool back afterwards. What? But you know, once you're in surgery and they remove that foreign object, they're not gonna give it back to you. It goes in the hazardous waste. So yeah, that was a dilemma. You're gonna have to do post-mortem care. So people that are deceased, while this may be gross, So people that are deceased, there are some fluids that get released from the body, some odors associated with that as well. It can become unsettling for some nurses. You will have to give some post-mortem care as well. And then there are ostomy bags. The contents of these ostomy bags are just liquid poop. So you will need to change the ostomy bag or assist the patient in changing the ostomy bag, and definitely educate a patient who has a condition to where they now need an ostomy bag. You're gonna have to empty out those contents and replace it. Then there are psychiatric and behavioral. Then there are psychiatric behaviors. You will find that some people will fling their feces at you in a protest about the care that they are given, or just that's just the way they're feeling today. They want to spread their feces all over the wall, or pee all over the bed, or or sometimes even worse, they may spit at you. You might deal with saliva as they spit. There are just some truly unhygienic behaviors that you will encounter with that. Now, on to bodily fluids. So I'm sure you know nurses deal with feces all of the time. You will encounter different types of feces, different types of smells, and fecal incontinence. So I've had to give a few enemas. I'll leave it at that. And so I had a patient that had enemas, had to have an enema like every 4 hours or every 2 hours. It was frequent. I don't remember, but I just remembered it was a task. So yeah, you will deal with feces, especially if a patient is not able to take care of themselves. Vomit. You will definitely see vomit. I have seen vomit, lots of vomit. Then there's also blood. I'm not so, blood doesn't really faze me that much unless it's just like shooting out like it's an anime. Then, I might have a reaction about it. But blood, I'm okay with blood. But if you're not okay with blood, understand you will be dealing with blood. This is the medical profession. So you'll have to deal with that. You'll have to deal with urine. You'll have to, an example of this is replacing some urinary catheters or inserting urinary catheters, so you might get some of these types of things on your shoes or on your uniform. Then there's sputum and secretions. This thing I cannot deal with. Mucus. Hearing the sound of mucus, suctioning mucus. This is my area where I just can't stand it. And I was good until I had to suction a patient in nursing school. So I had to suction, this is very high level, the hole in their neck. So jargon that you can, or language that you can understand. There's a tube, you have to suction that tube, and there's mucus. The sound is very audible. Now I did that, and then I was walking to the trash can to kind of dispose of some things, and there was another nursing student. I guess I look like, I don't know how I look like it, because at this time I was wearing a mask, days of COVID, and she saw me, and I guess I visibly looked sick, like I was about to throw up, and I did feel that way. And she was like, "You better hold it in, girl, you could do it." And I was just like, standing there like I was about to throw up, and thank God I didn't, but that is the one thing that gets to me. Another thing that can get to me, but I guess it just depends, pus or exudate draining from, a wound or whatever it may be, an abscess. Thick amounts of pus can really get to me, but not as much as mucus. So yeah, these are some of the things that you will have to, these are some of the most grossest things that you will have to deal with as a nurse. It's true. If you've heard any of these things, yes. And even if you work in a skilled nursing facility, then you have some patients there or long-term care that you will definitely encounter feces and bodily fluids and things of that nature, and mucus. So be prepared, still yourself. There are some ways that we try to develop to cope with this, like smells. We will put vapor rub or rubbing alcohol or something that overwhelms that or overrides that smell for us. Vapor rub really helped me. And some people have like tapped alcohol or an alcohol pad underneath or on their mask to help them deal with the smells. And you have to mentally detach from the task that you're doing. I mean, not detach so much that you don't know what you're doing, but you have to separate your personal feelings from the task at hand. Repeatedly remind yourself of why you're doing this. This patient really needs your help. They just really need your help. So understand that they can't do this themselves, or they need assistance, and this is why you got into this, and this is why you got into the nursing profession in the first place. Always prepare to wear protective gear, so your gloves, your masks, your gown, all of those things. Suit up and make sure that you're protecting your shoes, your garments, your life, your skin, everything. And you know, sometimes there's a humorous side to it. There's dark humor. A lot of nurses have dark humor. I won't say all nurses have dark humor, but you can find some of this usually in the nurses station, you know, afterwards. Honestly, the more you do it, the less shocking it becomes. I remember the first day in nursing school when I encountered a patient that was naked. You know, it's shocking to the system. Like, you don't see this every day. You come from an office career and bam, there's a person that is totally vulnerable and naked in front of you in so many ways. You get used to it. I mean, they're human just like you. So, I mean, human anatomy, it is what it is. But yeah, you'll have to do a lot of things that you haven't done before, and you need to find a way to detach and find some ways to kind of get around that. Now, the mucus thing, I guess I could have put in some earplugs at the time, but I am not sure that earplugs would have helped me, unless you can pluck my eyes out and not make me see mucus. You know, anything that looks like okra, you know, exudate, slimy stuff, it just, ugh. I don't know what it is, but I'm sure I would have gotten over it, and I have. I've actually done the tasks at hand and done what I need to do, and I've had a moment in the bathroom when I've needed to. So yeah, hopefully this is eye-opening for you and not enough to scare you away from the profession, but nurses definitely do deal with these types of things. Just wanted to come on here and confirm that for you. But anyway, hopefully you enjoyed or did not enjoy this video, but like, that it's useful information, maybe a little bit humorous of what it is that you actually will see if you become a nurse at the bedside. Bye.